so what is occupational therapy?
So occupational therapy is the art and science of enabling people to do their day-to-day activities that are important and meaningful to them. As an occupational therapist, our main goal is to promote health and well-being through occupation. This is achieved through working with people and communities to enhance their ability to engage in the occupation.
So what's an easy example for me to understand?
Well, if we're looking at something as basic as self-care, if you injured your arm, our role would be to put in place measures which allow you to still maintain your self-care, like an easy way to brush your hair, for example. So we would teach you how to use your left hand instead of your right.
So what exactly is an occupation?
An occupation is when a single person participates in something that holds significance and meaning to them. So pretty much everything else is an activity until an individual derives a meaning from it. Occupations can also be divided into 3 categories. There's self-care, leisure and productivity. So what is an occupation that you partake in?
I guess soccer?
So how would you feel if you couldn't do soccer anymore?
I'd be devastated.
Right, so soccer falls under the leisure category and it's an activity. However, because you've attached a meaning to it, it therefore becomes an occupation.
What type of people do you help?
So OTs can work with a variety of different people who have physical, cognitive and mental disorders, and the patients we work with can also be of varying ages, so infants to the elderly.
Cool, and where do you help? Whereabouts?
So occupational therapists can also work in a variety of different places depending on what you choose to specialise. So for me, I would like to work with children, so then I would probably work in a paediatrics unit of a hospital. However, OTs can also work in nursing homes if you choose to work with the elderly, or they can work in schools and universities and lots of other different places.
Cool, that's amazing. And what makes OT unique?
So occupational therapists try to focus more on the occupation that the patient can no longer do and less on the barriers like their injury. So for example, a physiotherapist will completely focus on your injury rather than getting you back to doing what you love, which is where an occupational therapist will help you.